Hemmett Health, it's Dr. Vicki. I'm in the clinic right now and I wanted to review actually some lower extremity exercises and my favorite abdominal exercise. I've gotten a lot of great feedback from the neck stretches, so hopefully you can incorporate these low back stretches and really learn how to do them well. So there's only 3 that we're going to be teaching today. One is for the hamstring, so that's the back of the leg here. Another one is going to be for the psoas muscle, which is a really deep core muscle that is a hip flexor that is tight in nearly everybody. And the third stretch is going to be for the piriformis, which is a hip external rotator. And then I'm going to show you my favorite abdominal exercise on the ball. Okay, so the first one for hamstrings, we actually want to avoid just simply going down and touching your toes. What you can do is put your foot up onto a footrest like this, about 12 inches or so. If you're tall, you can do 18 inches or so. And what you want to do is make sure your hips are rotated this way and facing forward. And you're going to put your heel up through here. And I always say you want to bring that posterior pelvic tilt, the one I told you about before. And you want to have a nice regal posture where your shoulders are back and your chin is slightly forward and you're simply bending at the waist. Doesn't need to do a really deep bend, but you're protecting your lower back by keeping this nice and tight here. If you want to intensify the stretch, you simply go down further, and then you can also bring your toes closer to you. And again, there's no bouncing. It should be a little nice stretch. You want to do both sides and hold for, I would say, about 15 seconds for this one. Okay? So the second stretch is going to be for the piriformis. So that's a glute muscle, a big deep glute muscle. And you do this when you're sitting. This is a really easy one to do if you have a desk job and you're sitting all day long. You're taking one leg over the other one and simply doing a figure 4. Again, you're locking your pelvis by doing that posterior pelvic tilt, having that regal posture where you're nice and straight. You want to think about hinging at the hips and keeping your spine straight and leading with that chin that's slightly up. So you're bending forward like this. Okay, and again, you're holding it like this. And then if you wanted to change the direction of the pull of the muscle, you can bring this in towards you. But again, you don't want to twist and go forward. You simply want to bring this knee up, hold it, and then go down again. Okay, and hold it for 15 or 20 seconds, and you can do both sides. This is a super easy one to do during work, where you can really kind of get a really deep stretch in quickly. Okay, so the last stretch, the psoas stretch, is a really kind of weird one to find. Again, the psoas kind of starts at T12 and runs on top of the lumbar spine and then kind of sneaks through the pelvic region and attaches sideways here. And so when it shortens, it's in hip flexion. So that's what it does. So if you're sitting again all day long, it's really tight. And it's also really a deep muscle and lumbar stabilizer. So if you do have any injury or low back, this one tends to get really tight. Okay, so if you think about it being tight, what we want to do is actually release and lengthen it. So I'm going to turn sideways. It's going to be like a modified lunge. Okay, so if I'm stretching my right side, again, tight is like this. So we're going to lengthen it and go this way. So we're just going to do a simple lunge like this. You want to make sure your hips are rotated forward like this as much as possible, right? Posterior pelvic tilt, again, you always want to engage that. And then you're bending your right knee, which is the back knee, a little bit through here. Sometimes this is enough to initiate a little bit of a stretch on the front of a quad, which is great, but you may feel it kind of deep in this groin region too, and that's okay. So again, from here, shoulders are back. This is nice and tight. You're bringing the same side that your leg is back on, that right arm to start with, bringing it slowly up over your head with your palm forward till about your ear, and then we're laterally flexing to the side. So really opening up this area. And I'll do that from the front so you can see it again too. Okay, so you're taking a step forward with your left foot to stretch the right leg. We're making the hips go straight. Posterior pelvic tilt. Okay, dropping into that lunge a little bit. Making sure you don't arch your back like this. You want to keep everything nice and neutral. Bringing up that same hand all the way up like this to your ear. Holding on tight and then bending away. So you can see how that is opening up this as much as possible. Okay, if you need to hold on to something, that's not uncommon, right? Because you're a little bit shaky. That's fine, just get close to something. Okay, last one is an exercise ball. So when you get on an exercise ball, this is actually perfect size for my body. You want to be at least 90 degrees here and 90 degrees here. So you want to avoid being too small where your knees are higher than your hips. That's what you want to avoid. Okay, so this is a perfect position. Simply bouncing will actually engage those deep core muscles, so just kind of doing a little bit of pelvic rotation side to side is really great. But I'll show you the first initial abdominal exercise to really work on some of these core muscles that we talked about during the posterior pelvic tilt video. Okay, so if you walk yourself out, what you're going to do is kind of push down like this. So your bottom is really close to the floor but not touching. It should feel kind of like a wall squat where you're leaning back into the wall, or the ball, excuse me, and you're trusting it. Okay? So when you're here, you don't want anything engaged. You want to be able to do it. It's a little bit wiggly and unstable, which again will engage those deep core muscles. But from here, you're going to do posterior pelvic tilt again. So you're going to be pushing that part of your low back right into the ball. So I'm going to do that again. This is neutral. And then posterior pelvic tilt, we're making it like this. And it should be nice and flat against the wall. And you can feel that tightness and engaging of that lower abdominal region. Okay, so you should be able to talk and be able to engage with that. Okay, so from here, what you're simply doing, you don't want to put your hands through here and tuck. You want to keep your spine in a neutral position, so your ears over your shoulders. So you can put your arms like this. I like to put them like this, whatever is easier for you. But for the purposes of the video, I'm just going to kind of keep it right here. Okay, so again, posterior pelvic tilt, and we're just simply really, really slowly bringing it up and really slowly bringing it down. Okay, and then another one slow up and another one slow down. If you do break that posterior pelvic tilt, then your exercise is done. You need to refocus and do that again. And to get a different pull, what you can do is get your obliques in. So again, you're going here, rotating about 45 degrees or so, and then pushing up on the side and relaxing, and then rotating here and pushing up on the side and relaxing. Okay, even if you do like 5 repetitions of really good ones, that's better than doing 45 ones that are incorrect. Okay, so you're looking for quality over quantity. So I hope that you enjoyed this video. If you have any questions, please put them down below. Otherwise, keep posterior pelvic tilting, keep stretching, and keep doing those neck stretches. See you next week.